Welcome back to All Things Plastics YouTube. I am a plastic surgery nurse. My name is Jalen.
And I'm also a plastic surgery nurse. It's Jasmine.
Today, we are going to be talking about Fajas. We're going to give you 7 tips that you need to follow in order to have a good recovery and stay snatched, and also give you some tips on apparel, what to wear, and certain clothing that will best fit you after your recovery. So let's get into it. Our first tip. We get this asked all the time. How long should we wear the faja for? And do I have to wear it all day? And it's like, I don't know how many times we're going to have to say this.
Reiterate it until it's engraved in everyone's brains. But yes, you have to wear the faja for a minimum of 3 months full time, 24/7, and then an additional 3 months, 50% of the time. So that means whether you want to wear it during the day or at night, and then make sure that you're consistent with wearing it in those time frames. So that's only going to help reduce your swelling, prevent fibrosis, and make your results as good as the surgeon made them.
And the time you should only be taking off your faja is to shower. Other than that, you should have your backup ready to go. As soon as you get in the shower and your faja's washing, you throw the second one on. So it's very important that you wear it 24/7. It just it promotes better healing for after your surgery.
I will say, when you are clear to start working out, I know it's a pain to wear your faja. So being out of your faja for a workout of an hour and a half is okay, but I highly, highly recommend wearing a waist trainer while you're working out. That'll help provide compression while you're working out, at least in the abdomen and back area, so you're not fully without compression for that amount of time that you're at the gym or at a workout class.
And another tip is make sure that the faja you're wearing is not too tight to where it's cutting off circulation, and it also could kill those new fat cells that are grafted, especially in the buttock area. I see a lot of girls buying fajas that have a lot of compression on a buttock just because you want that support, but sometimes it's too tight that it's cutting off circulation and it's damaging those fat cells, which means they're going to die and you're not going to retain that fat graft.
Yes, exactly. So too much compression doesn't mean that it's going to make your swelling better or your results better. I feel like sometimes people will think that the more compression they have, the more snatched their waist is going to get, but that's not necessarily true. We see a lot of people get skin damage, so that it's called a faja burn when their compression is too tight, especially too soon after surgery. So your skin right after surgery is very, very sensitive, and you're more susceptible to doing damage to it because it just went through a lot of trauma. So wearing too tight a compression can actually burn the skin.
And we will go over, there are 2 types of fajas. You have your stage 1 faja and your stage 2. Your stage 1 is you use that immediately after surgery for the first 6 to 8 weeks. And sometimes they will have some openings for if you have any drains or to use the restroom, just so it's easier. Your stage 2 faja is more compressed, and it really helps to enhance and shape. It's all about shaping when you're in the stage 2 faja. That's the biggest difference between stage 1 and stage 2. And with your stage 2, you don't have to buy it right away. I say you shouldn't, because your body is going to fluctuate, right? How swollen you are, how much fluid you still have in you. So definitely wait literally till you need it. I would shop right a couple days before you're advancing to your stage 2.
So your doctor will actually give you a time frame of when you should change it to your stage 2 faja. My doctor advised waiting until 3 weeks post-op, because that's pretty much when all the bruising is gone. You're able to do more compression and not compromise the skin. And so then when I went and I got that stage 2 faja. And like Jalen said, it is a lot. It's a noticeable difference in compression. So your stage 1 compression, but it's not too compressive, which I have here. Yeah, and it's not as big compressive, and that was my stage 2. And there's not much stress to it. So that's the difference.
And with your stage 2 faja, you have to get measurements. So I would not go about buying a stage 2 faja online. I know a lot of these Colombian websites, they market it very good. But with Jasmine, we went to Santee Alley, and they have actual faja stores. They ran about $150, and they measure you right then and there. And the girls I was watching, they know where to measure you guys at. So it's as accurate as it's going to get, and they actually allow you to try on the faja as well. So definitely try to get your second compression faja, even your first one if you need another one, in person. But I say the second one is much more important. Santee Alley is a really good, they have tons.
But if you're not local to the area and you're from out of state and you don't have the option of going in person, they even have that website from the Santee Alley online. And they do allow so they have an online store of the fajas that they sell in store, which I actually always recommend my patients to, because I really love my fajas. It's very durable. It didn't get messed up in the washer and the dryer. So I always recommend my patients for it. But yeah, they do offer exchanges too for size. If you order the wrong size, then you're able to exchange within 30 days.
And that's a big one. If you buy a faja online, Jasmine actually told me about this. Sometimes it's no refunds or exchanges. So you have to be very careful and look at the fine print, because if you order a faja too big or too tight and you're like, shoot, I just spent $150, too bad, too sad because they're
Yeah,
not
they're
accepting it back.
SOL.
Straight out of luck.
Yes.
Now, in regards to washing fajas, we have a couple recommendations that you want to wash your faja on cold and on delicate, and don't use any fabric softener. Just use a little bit of your detergent. You don't need a whole lot. Run it on cool and run it on delicate. And when you go to dry it, it is best to hang dry it. You shouldn't need it right away because you should already have a second faja ready to go. So air
Yeah.
drying it is the best. It won't damage it. No bleach.
Mhm.
If you are trying to get blood out of your faja, definitely use peroxide. Peroxide is very good. Try to get it when the stains are fresh. You pour the peroxide, it will literally come right off.
And if you put it in the you're at risk for damaging the little clasp, which the little hooks on your faja, and then you're not able to hook it up, and then you just did $150. So definitely take that into consideration. Just buy two, so that way you are able to hang dry yours.
Now, when it comes to dressing, you're wearing your faja for a long time. Clothing over your dressing and even under is very important. And Jasmine, if you want to let them know about the cami tanks that you bought on Amazon that worked for you under your faja sometimes.
Oh yeah, I loved my camis on Amazon. We have it linked in our storefront. They're just basic Amazon essential camis that I use because I have very sensitive skin. And then right after surgery, your skin is so sensitive. So it kind of just provides an extra layer of protection between your skin and the faja. So it's not rubbing and feeling uncomfortable. It feels like you're just wearing a t-shirt or a cami. So I highly, highly recommend purchasing those and then try them out. I've had some patients say that it works for them and some say it doesn't, but I think it worked great for me. Also too, because you have these boards that are hard. It feels like you're wearing a bulletproof vest, and those on top of your skin are not comfortable at all. So it's like an extra layer of protection.
And with clothing, say you have to go back to work or you're running errands, definitely loose fit clothing. You don't want to have tight clothes over your faja. I mean, you could, but the extra compression sometimes is not necessary. It can cause more damage than good. So having looser options, sweats, bigger pants, leggings, kind of. You don't want crazy compressed gym leggings. If you have a thinner pair, anything that's flowy and looser and a dark color. So if you do leak a little bit, you can't see it when you're out in public. Definitely is the way to go.
Yeah, and doctors will actually recommend not wearing jeans for the first 6 weeks after surgery because it is too compressive around the butt and it can actually result in fat loss. So anything that's too compressive and restrictive around the butt can potentially risk your fat there. So you want to make sure you have fitting clothes.
And post-surgery, your mobility is probably going to be limited. So having clothes that are easy access, things that zip or button up. I personally don't like buttons. And if you're a girly with acrylics, such a pain in the butt. Zippers are way easier than buttons. If you get arm lipo, if you get a breast dog, like consider if you're having to put stuff over your head. So anything that you can kind of just put on, zip up, things you don't have to shimmy into. Anything is easier, especially for the first 6 weeks of your surgery, is the best bet.
And then making sure you get one or two sizes bigger because you're so swollen right after surgery that your normal clothes is not going to fit you. But if it does fit you, it's going to be very, very, very tight, which is what we just said you don't want. So buying extra clothes, not so much because you won't need it for that long, but buying extra clothes that is more loose fitting. Like my scrub pants, by the end of the day, my butt did not fit in them. And I went up a size. So,
and if you guys really have to consider if you're going back to work at least 2 to 3 days after, 2 to 3 days, God, imagine 2 to 3 weeks after surgery, whatever your work is, maybe go buy 1 to 2 sizes bigger, probably 2, so you can be comfortable at work, and just maybe buy 4 options so you can wear it for 2 days, wash, just so you're comfortable. Because a lot of people don't think about that. They're like, oh, I could, hop back into this, but you are swollen, like Jasmine said, plus you're wearing a garment, plus you have your clothes.
Yeah.
So really take into consideration when you're going back to work, what apparel you need, and even casual wear too. So important.
Yes, definitely.
And tapering down from the faja, Jasmine can, best talk on this. You wear it for 6 to 8 weeks, then you advance and you're like, okay, I want to start taking it off and maybe wearing it 20 hours out the day and not 20, you know what I mean? How should people kind of taper off and gradually not wear it as much as they were before?
Yeah. So for the first 6 weeks, I wore that faja religiously with my boards. So I had the boards in the front and the back for 6 weeks. And then my doctor said, after the 6 weeks, you don't have to wear the boards anymore, but you still need to wear your faja. So then I went a size down on my stage 2 because there was some room because I typically have the boards in there. So then for 3 months, I wore the faja 24/7. And then after that, I kind of tapered down. So they recommend wearing it for another 3 months, 50% of the time. If you don't notice noticeable swelling, then you can reduce that time. To be quite honest, I was so sick of that faja that I went and I got a waist trainer. So obviously you don't need compression in the butt after surgery. So I went and I got a waist trainer that I wore for another 3 months. And I still wear it sometimes today to help. If I notice I'm a little bit swollen or I want to wake up with a really flat tummy, I wear this at night before bed and then I wake up. super flat stomach. So transitioning from wearing a faja, and then you can kind of go down to like a waist trainer once your doctor says you're ready, but it's usually after that 3-month period.
So following these tips along with your surgeon's tips allow for the best outcomes post-surgery. Faja care and apparel is very important and it is part of the process. And like Jasmine said, we have a lot of stuff on our Amazon storefront and it's separated into each category of surgery. So if you're having lipo BBL, you can click on that category and you'll see the camis, you'll see a lot of good stuff, some robes, some slippers, some compression socks, so that it's very convenient for you guys. And if you guys have any questions, you can ask them down below and also check out our Instagram, our TikTok for extra content on all things plastics. And that is all for now. So good luck with the faja. And remember, 24/7, it does not matter. Wear that faja.
It will be worth it.
Yes. You didn't spend all this money not to wear it.
True.
Bye, you guys.
Bye.